Hello friends, today our topic of discussion is obesity. Overweight and obesity are defined as abnormal or the excessive fat accumulation that present a risk to the health or a body mass index, which is also known as BMI. Over 25 is considered the overweight. When the BMI become more than 30, it is known as the obesity. So in this video we will discuss about the details why obesity occur and how can we reduce the weight with adopting the healthy lifestyle. Before starting our topic, my dear all friends, request you to subscribe my YouTube channel. Name is RM World of Medical Education because I need your love and support. Let's start our topic. The key fact. Worldwide, obesity nearly tripled since 1975. In 2016, more than 1.9 billion adults 18 years and older were overweight. Of these, over 650 million were obese. Most of the world's population live in the countries where overweight and the obesity kill more people than the underweight. 39 million children under the age of 5 were overweight or obese in 2020. Over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. Obesity is preventable. What are the obesity and the overweight? Overweight and the obesity are defined as the abnormal or the excessive fat accumulation that may impair health. Body mass index is a simple index of a weight for height that is commonly used to classify the overweight and obesity in adults. It is defined as a person's weight in the kilograms divided by the square of his height in meters. For adults, WHO defined as overweight and obesity as follows. Overweight is a BMI greater than or equal to 25 and obesity is a BMI greater than or equal to 30. BMI provides the most useful population level measures of overweight and obesity as it is the same for both sex and for all the ages of the adults. However, it should be considered a rough guide because it may not correspond to the same degree of fatness in the different individuals. For the children, age needs to be considered when defining overweight and obesity. Children under 5 years of age. For children under 5 years of age, overweight is weight for height greater than 2 standard deviations above WHO Child Growth Standards median, and obesity is weight for height greater than 3 standard deviation above the WHO Child Growth Standard median. Children aged between 5 to 19 years. Overweight and obesity are defined as follows for the children aged between 5 to 19 years. Overweight is BMI for age greater than 1 standard deviation above the WHO growth reference median, and obesity is greater than 2 standard deviations above the WHO growth reference median. Facts about overweight and obesity. Some recent WHO global estimates follow. In 2016, more than 1.9 billion adults aged 18 years and older were overweight. Of these, over 650 million adults were obese. In 2016, 39% of adults aged 18 years and over, 39% of men and 40% of women were overweight. Overall, about 13% of world's adult population, 11% of men, and 15% of women were obese in 2016. The worldwide prevalence of obesity nearly tripled between 1975 and 2016. Overweight and obesity are linked to more deaths worldwide than underweight. Globally, there are more people who are obese than the underweight. This occurs in every region except the parts of the sub-Saharan Africa and the Asia. Causes of obesity and overweight. The fundamental cause of obesity and overweight is an energy imbalance between calories consumed and calories expended. Globally, there has been an increased intake of energy dense foods that are high in fat and sugars, and an increase in physical inactivity due to increasingly sedentary nature of many forms of work, changing modes of transportation, and increasing urbanization. Common health consequences of overweight and the obesity. Raised BMI is a major risk factor for non-communicable diseases such as cardiovascular diseases, mainly the heart diseases and stroke, which were the leading cause of death in 2012. Diabetes. It may cause the musculoskeletal disorders, especially osteoarthritis, a highly disabling degenerative disease of joints. Obesity or the overweight can cause some cancers including endometrial, breast, ovarian, prostate, liver, gallbladder, kidney and colon. Childhood obesity is associated with the higher chances of obesity, premature death and disability in adulthood. But in addition to increased future risk, obese children experience breathing difficulties, increasing risk of fractures, hypertension, early markers of cardiovascular disease, insulin resistance, and psychological effects. How can overweight and obesity be reduced? Overweight and obesity, as well as their related non communicable diseases, are largely preventable. Supportive environments and communities are fundamental in shaping the people's choice by making the choice of healthier food and regular physical activity the easiest choice, the choice that is most accessible, available, and affordable, and therefore preventing the overweight and obesity. At the individual level, people can limit the energy intake from the total fats and sugars, increase consumption of fruits and vegetables as well as legumes, whole grains, and nuts, and engage in regular physical activities 60 minutes a day for children and 150 minutes spread through the week for the adults. Food industry can also help in reducing the obesity or the overweight in promoting healthy diets by reducing the fat, sugar, and the salt content of processed foods, ensuring that healthy and nutrition choices are available and affordable to all consumers, restricting the marketing of the foods high in sugar, salt, and fats, especially those foods aimed at children and teenagers, and ensuring the availability of the healthy food choices and supporting regular physical activity practice in the workplace. What are the prevention and the control? There has also been a decrease in physical activity due to the changing nature of many types of work, more access to the transportation, and increased urbanization. Lowering the risk of overweight and obesity includes reducing the number of calories consumed from the fats and the sugars, increasing portion of daily intake of fruit, vegetables, whole grains and the nuts, and engaging in regular physical activity, which is 60 minutes per day for the children and 150 minutes per week for the adults. In babies, studies have shown that exclusive breastfeeding from birth to 6 months of the age reduce the risk of infants become overweight or obese. Prevention and control. Many of the causes of overweight and obesity are preventable and reversible. However, no country has yet to reverse the growth of this epidemic. Although other factors are involved, the fundamental cause of obesity is an imbalance of the calories consumed and the calories expended. As global diets have changed in the recent decades, there has been an increase in the consumption of energy dense foods high in the fat and the free sugars. Please hit the button like if you like the video and give me a thumbs up. You can subscribe to my channel if you like what I do. And thank you so much for watching the video. Have a nice day.